2022 right now seems to be the year of the Omicron variant. The emergence of the highly transmissible variant has caused case numbers to shoot through the roof, leading to the current 7-day average of more than 40,000 cases per day across Canada. We know those numbers are probably higher. Joining us this morning to clear up some of the questions around Omicron so far, and like we're, 7 days into the new year, is a familiar face around here, infectious disease specialist, Dr. Isaac Bogoch. Happy New Year to you.
Happy New Year to you as well. Yeah, the year of the Omicron variant. Why can't it be like the year of the chicken wing or the year of the hockey stick or something more exciting?
We will get there. Right now, though, we are also, people forget this sometimes, but we're also in the heart of cold and flu season, which has led to the emergence now of Flurona. So when someone is infected with the flu and COVID at the same time, how does this combination affect a patient?
You know, this is being completely overplayed, right? This is not a unique issue. We've known that you can have multiple respiratory viral infections at the same time. It actually doesn't mean you have two infections simultaneously. Sometimes it can be, but a lot of the time it just means that you've cultured or you've identified two viruses in the same person. Again, if you walk around and start swabbing people, you're going to find a lot of different pathogens. And I really think this is, exciting for headlines, but it actually doesn't really mean all that much in real life.
All right, let's talk about Omicron and being infected more than once. A lot of people curious about this.
Right. So, I mean, it's also, we should acknowledge that we've only known Omicron has been around for a couple of months, so we certainly need to learn a lot more about it. Having said that, we've known from prior variants that people can get reinfected. So, it wouldn't surprise anyone if there were reinfections even with this variant. And, when we look at prior variants, reinfections really start to pick up between 3 and 6 months, and certainly after 6 months. Like, you do get some immunity, of course, after you recover from infection. But of course, you still can get reinfected. I'm sure we'll probably start to see those later on in the year.
We've asked this question before, that if you get Omicron before you get your booster, do you still need to get your booster? And the question there is, what's the efficacy of the booster compared to, getting it via natural infection?
Yeah, you should really get the booster, even if you have recovered from an Omicron infection. And, when we look back at other variants and you look at the degree of protection you get after recovery from infection versus from the protection you get from the vaccine, of course, you can't ignore the protective benefit you get from recovery of infection. That does cause some immunity, and of course it's helpful, but it actually looks like the immunity is more robust if you do get vaccinated. And so we are recommending, if people recover, once they're starting to feel a little bit better, it's okay to go get that vaccine. And in fact, people should do that.
I want to talk to you about two stories we're following today. The first one is about more than 50% of people waiting for a booster are apparently waiting for Pfizer as opposed to getting the Moderna shot. Is it worth the wait?
No, it's not. Moderna is really being offered to adults. It depends on where you are. There's different age cutoffs, but it's not being offered to, for example, teenage populations because of the slightly elevated risk of inflammation of the heart, which we don't see to the same extent in adults. All the data that we have to date points that Moderna has a very significant and robust immune protection, and it's safe. So I hope people who are offered Moderna take that vaccine. It's an excellent vaccine.
We've seen increased rates of hospitalization for children in the U.S. We're learning that in the last 2 weeks, 2 children have died from Omicron in Ontario. For parents who are concerned, their kids aren't old enough to get vaccinated, they're concerned about these rising numbers of kids becoming ill.
Yeah, it's very upsetting to hear these stories. These are just awful. It's tragic. It's absolutely tragic to hear this. I think, unfortunately, kids can get sick. Most kids don't. When you look at the rate of significant illness or severe illness in kids versus adult, it's minuscule. The problem is you have so much infection and such a burden of infection in the community that these very rare events suddenly don't look so rare anymore. Again, all of these are tragic cases, and we've got to really control the virus at the level of the community to prevent these from happening.
Okay, 1 week into January, and scientists in France have identified a new variant. It's the IHU. It has 46 mutations, more than Omicron, sitting at 37 mutations. The World Health Organization saying we shouldn't worry about it yet. It's just that line that we know now, variant of concern. What are they concerned about?
Right. I mean, this is just something to keep an eye on. It looks like it's being overcrowded by Omicron, and it doesn't look like this has taken off. But obviously, you can't sweep anything under the rug. You've got to watch this. When you talk about variants of concern, we're really looking at a few different things. One, does it spread more readily? Two, does it cause a more severe syndrome? Three, do the diagnostic tests work? And four, do the vaccines still work? I mean, I think this variant was discovered in September, and it hasn't exploded yet in France or elsewhere in the world. Again, can't ignore it, but it's pretty clear that Omicron is the current and significant threat right now, and we really have to take Omicron seriously.
Last question, and I'd be asking this if I walked into your office. I know a few people who have come down with Omicron or COVID over the Christmas holidays. One of the lingering effects seems to be this dry cough. Is that considered a symptom, or can you go back to work, go out in the community if you still have that cough but feel fine in every other way?
It's extremely common after people are recovering from a respiratory virus to have a lingering chronic cough, and sometimes it can take weeks and weeks and weeks for that to resolve. The key here is your fever going away? Have your other symptoms started to improve and started to dwindle? And have you waited the appropriate amount of time? And if you have, and all those three things are happening, you can go back to work. You know what else is also very helpful is rapid tests. I know they're not perfect, but if you have a negative rapid test, if those are available to you, those really also help to determine if someone is contagious to COVID-19 or not. Obviously, if the rapid test is still positive, you shouldn't be going anywhere.
Okay, I know doctors hate this, but I'm going to do it. It's like the hand on the doorknob question. Do you swab your nose and your throat?
Oh, man, depends on who you ask, right? Like, we're in a period of time of very rapid data acquisition. There's certainly anecdotal evidence and even some emerging published evidence demonstrating that the saliva turns positive before the nose swab. Some people are swabbing the throat before the nose, and anecdotally, that seems to help. Of course, if you ask the manufacturers, they say, no, don't do that. Use these tests as we describe using these tests. But you know what? I think stay tuned to this, because we might see some shifting policy as we see more and more data demonstrating that the throat swab or the saliva is probably more beneficial. So for now, I think a nose swab, and if you have a lot of these tests at home, because sometimes people get sent home kits of 5, you can do a throat swab well if you have an extra one of these tests lingering around. The key point here is regardless of where you swab, if that test is positive, treat it as positive.
Great, more shifting data, which means you'll be back with us next week. Dr. Bogoch, thanks so much.
Have a good one.
Hey, thanks for watching. If you liked this, be sure to subscribe here, or you can check out more Your Morning videos right here.